How can governments reduce healthcare wait times in Canada? SecondStreet.org recently traveled to Sweden to learn more about an interesting approach they use. They help patients live healthier lives so they won't spend as much time in hospitals. In Canada, the government spends billions of dollars each year treating patients for healthcare problems that are preventable. For instance, the Chronic Disease Prevention Alliance of Canada estimated that treating diseases caused by poor dietary choices alone cost governments $26 billion in 2015. But it's not just diet. A lack of exercise, smoking, and other lifestyle decisions cost the healthcare system billions to treat. For example, many cases of diabetes, heart disease, and joint replacement surgery could be prevented. Not to mention, many of these patients are suffering. Some are living with chronic pain. If Canadians live healthier, then the system could have more resources to treat patients with unavoidable health problems. In Sweden, they have a philosophy known as friskvård that is embedded in their healthcare system. Instead of just prescribing pharmaceuticals to patients, doctors will often prescribe exercise. If a patient wants help with developing a fitness plan that works for them, healthcare staff will help. One patient may have a plan that involves running or playing soccer, while another patient may have one that involves walking.
Friskvård is very important. If you see the amount of people are dying after their heart infarctions, they have decreased a lot the last 20 years. And you have forced that the time after you had your heart infarction, that we should speak about their smoking, their activity, etc. So we are doing quite a lot of things about that, but friskvård is very important.
A key part of Sweden's friskvård approach is that patients receive a physical prescription for exercise, just like they might receive a physical prescription for medication. It might sound like that wouldn't make much of a difference, but one article noted, there is also something psychological going on here. Patients respond better when given a physical prescription, rather than just being told what to do. A 5-year study of patients receiving prescriptions for physical exercise saw noticeable improvements in body weight, blood pressure, cholesterol, and other important indicators. In some parts of Sweden, doctors will get paid a little bit more if they talk to their patients about the benefits of exercise and living a healthier life.
If I ask you, if I'm a GP, and I ask about smoking, your habits and so on, I will get 1.5% more. It's a small amount, but if you have 1,000 patients, 1.5% is quite a lot.
Right.
And it's for you, it's very important that we begin to speak about activity and smoking, etc.
Since launching this idea over 20 years ago, other European countries have copied Sweden's approach. Do you think it's time for Canada to follow in Sweden's footsteps? Tell us what you think in the comments section below, and don't forget to hit the subscribe button.